Welcome to our postdoctoral fellowship in clinical neuropsychology at the Comprehensive Epilepsy Center, NYU Langone Health, the open house to introduce our fellowship training and give you a formal presentation and overview of the activities within our training program. We're going to go through a series of presentations detailing different elements of our training program, and we'll have a Q&A at the end. So first, this is a bit of an outline of where we're going through our presentation. And we'll start off with just some introductions. Dr. Morrison, training director within our program, our postdoctoral fellowship training. We have most of the rest of our faculty here joining us this evening, who will take turns introducing different segments of our program. Dr. Barr, unfortunately, is not able to join us this evening, but will certainly be available to anyone who would like to reach out and discuss the research component of our fellowship for any questions that he might be able to supplement that we're not able to address this evening. So first, I'd like to take you through just a little bit of the history of the Department of Neurology here at NYU. It's quite storied and fairly impressive in the grand scheme of things. The Department of Neurology at NYU was one of the first, if not the first, in the country. There's a little bit of a dispute with the University of Pennsylvania as to who has the claim of first. Their program began in 1871. But here we have Dr. William Hammond, who was the originator of the very first textbook in neurology that was published in 1867. He was faculty here at NYU and later became part of the an initiative that developed the medical school here at the hospital. So we could argue that we were sort of at the cutting edge of neurology back at the turn of the 19th century. Just an overview of the organization of the department. We have a number of divisions representing the different kinds of specialties within neurology. And so neuropsychology sort of exists within a couple of spaces with regard to the fellowship. So first of all, the fellowship occurs within the division of the epilepsy, the Comprehensive Epilepsy Center. And second of all, we have our own neuropsychology division, which includes several neuropsychologists, both within the Epilepsy Center and throughout different corners of the Department of Neurology writ large. So our department here at NYU is fairly impressive, even if you don't believe our claim to be the first department. The recent rankings, national rankings, our Department of Neurology Neurosurgery here at NYU is ranked #1. Nationally 3 consecutive years in a row. So what that means is we have a very deep and rich talent in our Department of Neurology, and those are the folks referring patients to our service. So it really makes for quite an enriching environment for us as neuropsychologists to have such excellent colleagues. Also, with regard to history a little closer to home, NYU and its sister hospitals, Bellevue, and some of the other hospitals associated with the enterprise have long been associated with psychology and neuroscience and neurophysiology, psychophysiology, and some of the earlier developments that we lean on today. For example, the Bender Gestalt was developed at Bellevue Hospital. Of course, we know David Wexler was at Bellevue, hence the Wexler-Bellevue scale, the original precursor to the WAIS. In the world of psychology rehabilitation, we can claim to have the first cognitive rehabilitation unit, and certainly spearheaded by a lot of the really groundbreaking individuals within the field. And certainly with regard to psychophysiology, we can't forget the work of Hans Lucas Teuber, who was one of the earliest pioneers in psychophysiological assessment. So lots of rich history here at the institution, and that tradition continues with the impressive work of the staff at present. The neuropsychology training at NYU is also pretty rich. You will find neuropsychology in the Bellevue Hospital and the Rusk Institute of Rehabilitation, obviously here in the Epilepsy Center, at the Child Studies Center, over in the Department of Psychiatry, and other departments as well. We have a lovely collaborative relationship with many of the folks throughout the enterprise. And again, we're able to draw on those resources and really enhance the training experience, though we exist within the Epilepsy Center. The history of our own fellowship goes back almost 3 decades now, back to 1996. We've had 2 fellows per year since 2000, and we became an APSIN member in 2007. So this is a long-standing postdoctoral fellowship training program, and has really seen a lot of enhancements and changes and exciting things over the years. Just a very basic overview of the fellowship activities. We're certainly going to drill down on a lot of these things as we move through the evening. The clinical activities are on site. We focus on consultation and assessment. There are no intervention opportunities. So if that's something that is important to you, this might not be the best match. Our training program adheres to currently the Houston Conference guidelines. We're all waiting for the Minnesota guidelines to come out. But everything that I've read so far, we're absolutely in compliance with the Minnesota guidelines as their current draft form is reflected. We follow a clinical scientist model. We have a research component that befits that clinician scientist model. And our goal is to produce individuals who are ready to stand on their 2 feet as independent clinicians and are prepared to move through the board certification process in clinical neuropsychology. So these last couple of points we'll focus on a little bit more in a little bit. Just a brief comment about our application requirements. A person must have a doctoral degree, a PhD or a PsyD from an APA or CPA accredited program, must have completed an APA or CPA accredited internship, and they must meet the eligibility criteria for the limited permit here in New York State. The fellowship is 2 years full-time, and the stipend is currently $70,000, although I believe there's an increase in year 2. I don't know exactly what that is. It's a little bit variable year to year. And NYU has a very comprehensive and competitive benefit plan, which gives you access to amazing healthcare, free financial management services, other kinds of benefits that you might find useful in your personal life. There's 24 vacation days, and travel expenses are covered for 1 conference per year. So quite a lot that goes above and beyond the stipend that is associated with the training program. As I mentioned, we're an APSIN program. If you haven't yet heard of what APSIN is, here's just a little bit of information and some links if you need to go and investigate further. Our match number is there on the screen, and it's important that applicants understand that we will absolutely adhere to the rules of the match program to the best, responding to any needs or inquiries that the applicants may have, but within the rules of the match program. So I think I'm going to do a little transition and introduce my colleague, Dr. Zachary Rush, who is going to describe a few things about our clinical training activities. Dr. Rush.
All right, thank you. Okay, so just kind of as a broad overview of the clinical training. So the setting is predominantly outpatient in terms of cases seen, although there is an inpatient element. So you would see cases across both inpatient and outpatient. There are multiple supervisors. We're now back to our full complement of 3 adult supervisors and 1 pediatric. Actually, I'm lifespan, so it's 2 adult, 1 lifespan, one pediatric to be technical. But you would get experience with working with multiple supervisors and different perspectives there. In terms of the caseload, the general expectation is 2 clinical evaluations per week. Obviously, in a setting where we have a lot of outpatient and inpatient cases, the actual flow varies some. But we try to keep the caseload on the lower end because there are a lot of other responsibilities that our postdocs have during the week, including administrative and organizational responsibilities. Obviously, especially as you get later into the postdoc, supervision, which I'll talk more about in a moment, and integration into different multidisciplinary contexts, whether it's procedures or our surgical case conference. We see a lot of different types of patients, a wide age range. If you're interested in pediatric experience, that could be quite young, like 4 or 5 years old. If you're more adult focused, somewhere between like 16 all the way through older adulthood. So we routinely see dementia cases in late adulthood, but are seeing patients across the lifespan frequently. Our catchment area is quite large. So being that we are #1 in neurology and neurosurgery, a lot of people will travel to NYU to get their care from other parts of the country or from other countries. So our catchment area is not just the tri-state area, it's actually most of the country and even from abroad. So very diverse culturally, linguistically. I can say that we routinely see patients where we're using interpreters or doing the testing in different languages with a technician or fellow if they speak other languages. So that frequently comes up. So very culturally and linguistically diverse and from very different backgrounds. We have we get referrals from a very diverse range of sources. So it covers the gamut. While our focus on the epilepsy service line can be epilepsy, and we do see a wide variety of etiologies for epilepsy, including like autoimmune, post-traumatic epilepsy. Sometimes we'll see patients who have like a history of seizure, but that's not really the presenting concern. They have other things going on medically or psychiatrically that are driving their cognitive difficulties. We also routinely get referrals for dementia evals or memory concerns. That's like the bread and butter of neuropsychology. So certainly our service is no exception to that. We'll see those cases routinely. We see a lot of pre-DBS cases, so movement disorders of various kinds, tic disorders, kind of in line with that. In that we see or participate in intraoperative mapping procedures. We'll see tumor patients or patients with different types of brain cancers who may come up in that context or even outside of that context. And we'll see other general neurology referrals as well. So really quite the wide range. And an inpatient, one of our like main referral sources is the transplant teams. So again, really getting broad exposure. So despite the fact that the setting is in a comprehensive epilepsy center, you're really seeing many different types of neurological and psychiatric conditions coming up routinely. All right, I think we can go to the next slide. Okay, so kind of I touched on this a little bit, but one of the responsibilities of fellows on our service is to first see and then kind of assist with and ultimately be supervised leading different procedures, including WADA testing and language mapping, whether that's extraoperative at the bedside on an inpatient unit or intraoperative in the OR. You can read more about the specifics of these procedures if you're not as familiar. In this book, edited by Dr. Barr and Dr. Morrison, Handbook on the Neuropsychology of Epilepsy, it has chapters on these specific procedures. There's also a lot of great articles in the literature now covering these procedures and different variations of the procedures, especially WADA testing, based on kind of what sedative agent you're using. But our fellows get experience not only seeing, but actively participating in these procedures. Obviously, the flow for procedures varies depending on demand, but they routinely come up, and we've actually been getting quite a few recently. So kind of how that plays out in terms of the fellowship, our fellows are on monthly clinical rotations. So 1 month, one of the fellows is covering morning inpatient bed rounds and consults. So we still kind of do rounds on the inpatient unit routinely. So depending on the day of the week, you'll be working with a different supervisor covering inpatient bed rounds. If you're on that month, in which you'd be presenting cases of inpatients to the externs who likely would be testing those cases. And that can cover a wide variety of things. So obviously, we see a lot of patients on the epilepsy monitoring unit, but like I was alluding to earlier, could be transplant cases, could be other inpatient referrals, whether it's from psychiatry or general medicine. But you'd be actively presenting to trainees at different levels under the supervision of your supervisor, the different inpatient referrals that come. Along those lines, also like in terms of learning for professional development and getting you ready to kind of be independent at the end of fellowship, you would be kind of managing the inpatient referrals as they're coming in. So like screening the admissions list, kind of prepping for what cases might be coming our way, and helping kind of plan out the week. So you get used to the flow of a service. And then on the other month rotation, you'd be actively participating in doing the procedures as they come up. So if we get referrals for WADA testing and intraoperative or extraoperative mapping, again, at the beginning of fellowship, you'd be seeing those procedures done and then kind of gradually worked into assisting and then leading those procedures over the course of the fellowship. And when you're on the procedures month, then you're also presenting our epilepsy cases at our weekly multidisciplinary surgical conference with our colleagues from neurology, neurosurgery, and radiology. So very advanced training available on this fellowship, a little different from other fellowships where you'd be doing mostly testing. You're going to get experiences doing these specific procedures and getting experience kind of with administrative and organizational responsibilities that are more unique to an epilepsy-focused fellowship. All right, we can go to the next slide. Okay, so the last kind of thing in terms of giving an overview of the clinical activities is over the course of the fellowship, you get experience of doing tiered supervision. So we typically have a large cadre of externs. Now that we're back up to a full complement of supervisors, I'm sure that extern class is going to grow back to its normal size. But as you get, especially later into the first year or even into the second year of fellowship, you'll begin getting more experience doing tiered supervision. That would begin initially with like test administration and scoring and conceptualizing cases. And then as you get more experience doing that, then also doing supervision of report writing. And then usually later into fellowship, to get you ready for independent practice, there's also like tiered supervision of like using a technician or a psychometrist to do testing, because it's a different experience when you're not in there getting the behavioral observations, or you have to work with someone who doesn't have the same knowledge base that we do. and kind of being able to work with an individual to get good data and kind of modify the battery as needed. All right. I think this next section is also me, so I'll continue to give an overview of our didactic activities at this time. So kind of start broadly. There are a number of different grand rounds available through NYU that cover the entire lifespan. So on Tuesdays at 8 a.m., there are adult grand rounds, and then in the afternoon, there are pediatric grand rounds focused on a variety of topics. And this is covering kind of the whole range of neurology, so it's not just epilepsy. There are often topics on like MS or developmental conditions, even training and professional issues in neurology. So sometimes they're on like ethics topics. There are behavioral health and psychiatry grand rounds that come up on Wednesdays and Thursdays, covering topics in mental health and psychiatry, again, across the entire lifespan. And the speakers for these grand rounds are both like within and outside of the institution. So sometimes they're different people from neurology, neurosurgery, or different departments within the institution that have expertise in these areas and are speaking on topics. And sometimes we have featured guests from other universities and hospitals across the country coming in to speak on their expertise in these areas. Actually, we'll go back, I think.
Oh, sorry.
No worries. Then on Wednesday mornings, also specific to the Epilepsy Center, there's a journal club that features different topics in epilepsy that the fellows, the attendings, different people from like the research sector instead of just the like clinical section of the Comprehensive Epilepsy Center are speaking on a number of topics. So it can cover things like journal clubs on articles that have been recently published in the literature, case studies and series in the literature that are like interesting or provide like unique perspectives, or ongoing research projects that people are getting feedback on. Also, again, sometimes featuring outside speakers that come in to present on their expertise in certain areas. That is epilepsy specific, so it can cover things like EEG interpretation, different epilepsy treatments, cognitive functioning in patients with epilepsy, ASM side effects, or anti-seizure medication side effects. Sorry, you get two in your zone sometimes. But again, wide range of topics. Okay, now we can go to the next slide. Thank you. All right. So then on Tuesday and Thursday afternoons from 4 to 5, we have our neuropsychology didactics. This is tailored to all training levels because this is when our externs will participate in didactics during the week. But we have interns and fellows also from different departments joining, whether that's child studies or Bellevue or the Department of Psychiatry. The topics, again, cover the entire lifespan, so pediatric to geriatric, covering a wide range of things that you would need to help kind of prepare you for the topic areas that are covered on boards. So these are often covered by either supervisors within the Epilepsy Center or the Child Study Center. Our fellows sometimes give didactics as well on specific content areas. As part of the broad neuropsychology didactics on Tuesdays and Thursdays, there are also periodic mock fact findings for the externs. So at the extern level, the fact findings are in a group format where they kind of rotate asking questions about a case. The neuropsychology fellows are actually the ones who proctor the fact finding for the externs. So you get experience actually like being the proctor and leading the fact finding, which is good, gives you different perspective, and can also kind of help prepare you for boards by getting that different perspective and getting experience like providing the information, seeing how they're asking questions, helping them tailor asking their questions. So I think it's really helpful both for the externs to get that initial exposure and also for the fellows to kind of approach it from a different lens. All of the supervisors are there in attendance to kind of provide feedback to the fellows too. So it's a good training experience at all levels. Then the fellows also individually do fact findings. Those are usually during the postdoc journal club. So those aren't open to like all training levels. So the postdoc journal club and fact finding is really just the postdocs in the Comprehensive Epilepsy Center and Child Studies. Although I think we also have one on the MS service line that's currently attending. But that's specific to the postdocs. So weekly, it's usually a journal club where you're covering either different like chapters or articles in the literature on various topics, where you will be coming up with like questions or different things to discuss like as a group, and approaching these topics at like a higher level and from different perspectives. Kind of getting that more advanced learning. But in that context is where the postdocs do their fact-finding exercises. So those are proctored by one of the supervisors, and that's in an individual format, more in line with the actual absent fact-finding exercise, so that you can get experience getting prepared to do that. And that occurs multiple times throughout the fellowship. And even as some of the early career attendings are preparing to take the fact-finding exercise, they may also do fact findings in that context where the fellows can kind of see them preparing and getting ready to take the actual version. All right, I think there might be, yep, one more slide. Okay, good. So as an absent program, the key is to prepare you not only for your career, but also for board certification, because we want to see ideally everyone in our field become board certified. That is certainly the goal, but for our fellows especially. So in line with that, we do the absent specific board preparation. So at the end of year one, the fellows will take the mock ABIP written exam. And so those didactics that I just talked about, whether it's the fellow specific didactics or the neuropsychology didactics that are across all training levels, are covering the different topic areas that you'll see on the actual written exam and are help preparing you over the course of the year to have the knowledge base to take that written exam and feel confident that you'll do well. Obviously, it's at the end of year one, it's not at the end of fellowship, so we don't expect you to know everything. But it is a good measure of kind of how your learning is coming along. It gives us a sense of areas that in year two might be areas of weakness that we need to kind of brush up on more, or the areas that you're really excelling in and becoming an expert. That's what we love to see as supervisors. Then, like I said, throughout the course of the fellowship, at least 2 times per year, you're going to do the practice mock fact findings individually with the supervisors proctoring it, or one of the supervisors proctoring it, and the other one's in attendance to give feedback as well. That leads up to the final mock ABIP fact finding at the end of year 2 of fellowship, which are like standard cases that are provided by absent, in which kind of really shows everything that you've learned, really seeing the culmination of all your training and helping you hopefully feel confident that as you're going into your career that you'll be ready to take boards, or knowing at least the areas to brush up on, so that you can kind of quickly become board certified early in your career. And then, like I said, from the different perspective, the fellows are also taking the examiner role in fact-finding exercises with the neuropsychology externs, which happens frequently throughout the course of the training year as well.
Okay, thank you, Dr. Rush. I'd like to introduce our pediatric specialist, Dr. Jennifer Rosenberg, who's going to talk about the pediatric component of the training, which can be modulated depending on interest. Dr. Rosenberg.
Thank you. So I'm the pediatric neuropsychologist at the Epilepsy Center. Obviously, as you all know, this is really an adult-focused training program, a fellowship program, but there are opportunities for experience in pediatrics depending on fellow interest. So you can kind of think about it more as a minor rotation, anywhere from no pediatric training to up to 20% we can certainly work with. And again, this really is just dependent on fellow interest. I largely see outpatients in the Epilepsy Center, occasional inpatients, but this experience would probably be largely outpatient, just given the patients that I see. I see children and adolescents with a range of neurologic and developmental diagnoses and disorders. I only see patients, though, with some sort of medical diagnosis. So these aren't psychoeducational evaluations. Oftentimes, we do address other comorbid concerns or diagnoses, along with whether it's epilepsy or other neurologic diagnoses, but it is a medical population that I work with. Currently, I am only seeing patients that are referred from the epileptologist within the Epilepsy Center. So I do see a lot of patients with epilepsy, but as was mentioned on the adult side, that doesn't mean that's the only presenting neurologic concern or neurodevelopmental concern and so forth. Also, this was already mentioned, but our didactics do cover the lifespan, certainly to prepare you for board certification. So that does include pediatric focused topics. We work with other pediatric neuropsychologists within neurology and in psychiatry or the Child Study Center. So Dr. Locascio is within the Department of Neurology, but at NYU Brooklyn, and she's a pediatric neuropsychologist that certainly participates in our didactics and does give some of those presentations. Dr. Tam is in the Department of Psychiatry and primarily works with HEMONC populations. And then, as I already mentioned, the Child Study Center is also within the Department of Psychiatry, and there are several neuropsychologists within the Child Study Center that also participate in our didactics and give some of those presentations. As you can see here, we cover a wide range of topics within our didactics and some of the pediatric topics, as you can see. So, of course, epilepsy, outcomes following epilepsy surgery, TBI, acquired brain injury, HEMONC, stroke, and neurodevelopmental topics as well. So autism, intellectual disability, ADHD, and certainly we see these comorbidities frequently with neurologic disorders. We also do pediatric focused fact findings to prepare for board certification. And these are really with the fellows through the Child Study Center who are more pediatric focused. So currently it's myself, Dr. Locascio, and Dr. Fiedler, who's through the Child Study Center, who are really overseeing the pediatric focused mock fact findings. And again, with the goal of really to prepare the fellows for board certification. Even if you are adult focused, you're still going to have to know the pediatric topics. So it really is important to cover all of those areas.
Thank you, Dr. Rosenberg. I'd like to transition to Dr. Isabella Appleton, a new faculty member with us. We're very excited to have had her join us and be part of our training program. As a graduate herself, she can speak directly to the experience through the course of Q&A or interviewing or in email offline. But I'd like her to take us through some of the other activities of the fellowship.
Yes, so I'll talk about the research activities, but as Dr. Morrison said, I just finished fellowship this past year and just started here. So obviously I enjoyed it and wanted to stay, and happy they got to have me, but that they would have me. So in terms of the research, it's around 20% of your time. You are required to do a research project. We have several different databases that you could work with, or you could start a study, but you would kind of have to come in, if you wanted to start a prospective study, with some ideas in mind so we could get the IRB rolling right away. We have several different data sets. One is sort of a registry of a lot of the epilepsy patients. So they're both pre-surgical patients as well as patients we've seen who just have seizures, but we're sort of just characterizing their seizures at the time. They might also have psychiatric conditions. So there's a wide data set there of epilepsy patients. We also have one study that's on accelerated long-term forgetting in epilepsy patients that's available to work with. And we're looking to start another data set that will have a wider range of patients, neurosurgical patients, possibly DBS patients, and dementia patients. So we'll have several data sets, hopefully, for more than we have currently for the next fellow to work with. So in the first 6 months, you should sort of identify a topic that you are interested in. And by the end of the first year, you'll be responsible for writing up a proposal of what your project will be. Then within that next 6 months, you should have finished your data analysis and write up. And as a part of the fellowship, it's required to present the project at like a professional meeting or conference. And you should be done by the end of the 2 years of the fellowship with your project. And you'll also be responsible for presenting it to the externs as your research project in a presentation at the end of the second year. And then the hope is that you would submit the project for publication at the end of fellowship. So these are just some previous projects that have been done recently, looking at various cognitive phenotypes in epilepsy. So this has become a hot topic in the field. And more recently, one of our fellows looked at whether cognitive phenotypes could be studied using the R bands as opposed to a larger surgical battery. We've also had fellows study looking at personality assessments in epilepsy, looking at subjective memory measures. My project was actually kind of a combination of some of these, looking at cognitive phenotypes and subjective memory in patients with epilepsy. And then I already sort of talked about that rapid forgetting study. I think, yeah. So these are just some of the previous topics I went over a little bit that the most recent fellows have done. Yeah, I think
You're all set? Okay. And on to the next topic, a virtual tour of our center since we don't have people on site anymore. Oh, documentation. I'm sorry, documentation first.
Yeah, so you're going to get really familiar with using Epic. This is the medical record system that we use. So for each case that you see, you're going to be responsible for doing a chart review, and you'll get really good at learning what information is important to look at and what you don't need to maybe focus on. You're also, as Dr. Rush was saying, going to be helping to lead bed rounds and sort of present these cases to the externs. So you're going to have to be familiar with navigating the medical record and finding that information and the key pieces of that to be able to present in sort of a short way during bed rounds. We have different reports that we're writing depending on the consult that we receive. So we tailor everything to whoever we're receiving the consult from. So our inpatient consults that come from like transplant or psychiatry are typically shorter. Apologies for the ambulance in my background. So these are, 1 to 2 pages. Our reports are in, the new model of writing. So they're bulleted and streamlined so that the providers who are receiving them can get the information they need most expeditiously. And then in addition to inpatient consults, our outpatient reports are around 4 pages. It really depends on the case that you're seeing. But again, a lot of the pages will be sort of bulleted information, and then you're going to synthesize kind of the larger points. And then the summary and formulation will be typically in paragraph style. And then a little virtual tour. So I don't even think that this patient room does it justice, but maybe see.
Let's see. So we are located right on the water. So this is a room looking out over the East River. Dr. Abelson will take us through the tour here.
Yes, so this is on the epilepsy monitoring unit. You can see this is one of the inpatient rooms there. It's set up for video EEG monitoring. So there's cameras in the room, and the patient will be hooked up to an EEG, and you would be doing the testing, either with the patient sitting in a chair if they're able to do that and it's not a risk for them, or at bedside. And these rooms are very nice, as you can see. They also have ones that view the Empire State Building, so it's actually a really lovely place to test and work. And then also over in our inpatient unit in Kimmel, we have various work areas. So this is an example of one of them.
Touchdown spaces is the new model.
Yes. So you be bringing your things, but we do have a work area where we keep test materials over on the unit. So you're not going to be like carrying test materials from our outpatient clinic to our inpatient unit usually, but you are going to be using various different types of workspaces and computers. This is another work area over on the epilepsy monitoring unit.
And the East River again.
Yeah, one of the things that makes it like very conducive to being able to work many places at NYU is that we have it set up where we have a virtual desktop that connects to our servers. So you don't have to like remote into a specific computer terminal from like any computer, even like personal laptops. You can log in to our virtual desktop and access the server. And be able to access any of the like scoring materials, manuals, test forms that you need. So it really is conducive to having different touchdown spaces where you can kind of work at the hospital or work at the epilepsy center in various offices, and kind of really gives a lot of flexibility to like quickly access the things you need regardless of where you're at.
And we scan our clinical materials, so you don't have to worry about, oh, I left the chart in the other building or whatnot. So increasing your flexibility.
Yep, and over at Kimmel on the 7th floor, there's a very nice outdoor area. So if you like bringing your laptop and you have everything scanned, you could even work outside if you're just report writing and it's not too sunny.
Excellent idea for our next video.
And then over at Charleston at the outpatient center, this is an example of our consult room where you would be testing patients there. So also set up with a nice computer and workspace and all the test materials. And there are a couple areas in the outpatient clinic for you to work as well.
More touchdown spaces. Yeah. The modern era is no longer office-based. It's more mobile. A lot of the physicians no longer even have offices. And so every computer throughout all the NYU buildings, you can sit down, log on, and all your stuff is right there. Don't have to carry anything with you. Okay. I think a few final details. Here are some of the dates that are pertinent to the recruitment season. Things to keep in mind as you're planning your applications and with regard to the match specifically. So we're obviously deep into the season, and the dates that are pertinent to the fellowship and some rough deadlines that you saw in some of the earlier slides. Okay, we've already discussed a little bit some of the benchmark evaluations with regard to the APSIN program, but exit criteria for graduating the fellowship. This is important to keep in mind. These are our goals to make sure we're bringing along all of our trainees to meet these benchmarks. Advanced skills in neuropsychological evaluation, treatment, consultation, advanced understanding of brain behavior relationships, scholarly activities, submission of something for peer review or presentation. Exit criteria included eligibility for state licensure. In fact, the state licensure actually has to happen in year 2. So the fellows will need to take and pass the EPPP by spring of the first year, so that they can submit their materials as soon as they meet their 1-year postdoctoral supervision criteria, so that they can get their license. Because in New York State, there's a limited permit for the year 1, but then thereafter one must have their license for year 2. So it's critical that if you haven't already taken and passed the EPPP, that happen by about spring of the first year. And of course, making sure that our graduates are eligible for board certification. These are our benchmark exit criteria. Here's just a listing of going back the last 24 years or so, 25 years of our fellows, and kind of where a few of them where they're at. I think I might need to update a few of these. Perhaps folks have moved on. But it gives you a sense of our history, and that our folks are out there and getting jobs and doing great things. And you'll see quite a number at NYU have come back and come back for faculty positions at our enterprise level center. So just some reminders about the actual application. The deadline, that should be the 16th. We were going to say December 15, but that's a Sunday. So actually that should be Monday, December 16, but we'll give a little grace there since our date is wrong on the form here. But go ahead and send those materials to me, and you'll want a cover letter, a CV, 2 sample reports, 3 letters, and so forth. We're doing our interviews virtually, as I think is the new standard. And we're doing rolling interview invites this year. So as soon as an application is complete, we're starting to review them. We're not waiting for the deadline. And so it's it's possible rather that people will be receiving interview offers even before our deadline. We're just trying to be expeditious and a little more efficient this year. We're going to see how that works. So this is how you reach any of us. You can see there's a method to the system of emails here at NYU. So please feel free to note these, reach out to any of us for any questions that you might have prior to or during the application process. I'd like to also share with you the contact information for our current postdoctoral fellows. And they are happy to field questions about, being here and the training and what they're getting out of it and so forth. So we are more than happy to have you reach out to them as well. So that brings us to the end of our presentation.